Thank God they don't go into the cell, because Dr. Lanz proved with radioisotope testing in 1990 the amount of bad oils in the cell is proportional to what you're eating. So if I'm eating half good organic oils and half supermarket oils, it's 50-50 in the cell. Even though they're all waiting to get in, they don't get in. But they cause inflammation.
Can I ask you another question about the
but
fats?
Saturated fat, no issue. And there's no saturated fat in an arterial clot. Excellent question. It's 87% omega-6 that's been processed. Is it an arterial clot? This is in the heart disease journals, and nobody is saying this. Even the American Heart Association, back in 2009, 15 years ago, said to call omega-6 inflammatory is wrong. It is highly anti-inflammatory. You have a naive understanding of biochemistry. So this is how bad our medical profession is in America. And then, unfortunately, the rest of the world follows us. They forgot what was said 15 years ago. But it's like in the medical profession, it always starts with me. There is no history. I'm an engineer by training. And you watch the engineering shows, and it's always the brilliant invention today was based on the brilliant engineer that came up with this 10 years ago, who stood on the shoulders of the genius engineer from 50 years ago. In medicine, nope. There's no history. It's just me, me, me. And look what's happening. America's the sickest developed country.
Oh, yeah. Well, I think it's also interesting what you just said there about clots being primarily omega-6.
87%.
87%. And yet the heart foundations will be telling us to avoid saturated fat. But
there's none in there.
But to consume, and this is actually part of what I often say, it's a great business model, just not a very good health model, that the advice by the Heart Foundation to avoid saturated fat and eat canola oil, safflower oil, sunflower oil, which makes up the majority of the clot, is quite a remarkable public health message.
It's disgusting. Let me tell you where this came from. So I've got the references right here. That's why I have these glasses on. Felton, quote, dietary polyunsaturated fatty acids and compositions of human aortic plaque, Lancet, identification and quantification of unique fatty acid and oxidative products in human atherosclerotic plaque using high-performance lipid chromatography, so you can analyze what's in there. This isn't somebody guessing. Annals of Biochemistry, structure elucidation of oxygenated lipids in human atherosclerotic lesions. Eicosanoids, that's the long-chain derivatives of the parents. That's the technical term. They're called an eicosanoid. That's prostaglandins, leukotrienes. 3 major medical references, journals, the best in the world, they're not touched by the medical profession. It's sinful.
It is sinful.
Very, very hard, because I talk about this like you do, and people go, yeah, but the Heart Association says this, my doctor says this. They're all wrong, but truth today doesn't seem to matter. It's really, really unfortunate. That's why I get so passionate about this.